good day, everybody? It's Kevin back with my tea of the day. Welcome to Season 2, Episode 2. I'm back to back because, I've been gone for a few weeks. And I definitely wanted to get into some history type aspect. Who knows about the Tuskegee experiment? And what that did to our black men. So, it took place in Macon, Alabama, like Macon County, Tuskegee. And this experiment was based upon basically picking out what African American men had syphilis, and then watch them die from syphilis. Not try to help them, not try to cure them, not try to give them any medical attention, but they're watching them die from syphilis. This experiment lasted 40 years. So they took the African man who was poor and uneducated, illiterate, so they couldn't really read or write, and they didn't have any money. So, of course, he probably tried to offer them money or try to offer some X, Y, and Z to be part of this experiment to see how syphilis builds up and does what it does in the African American male body opposed to a white male body. But my thing is, the white men got treatment. The black men did not. You purposely killed off a black man from them. You purposely allowed us to die. You purposely didn't care about our existence at all. And that's a problem. So it lasted 40 years, and then you wonder, ask yourself, why would this experiment last 40 years? After the first trial, or the first person and the second person, wouldn't you have found your findings by then? No, but they wanted to wait for years just to see us die off. And then evaluate our bodies to see after we die. Fun facts. Most of them were sharecroppers. Another fun fact, but not so fun. $65 on education for every white kid. For every white male. They pay $65 for their education. But for a little black boy in Alabama, they pay less than $7 for ours. We was doomed from the beginning. They didn't want us to be educated. They didn't want us to feel empowered at these times. And I say that to talk about the pandemic and the vaccines and the disparity in healthcare for African Americans. So we can go in a hospital, any hospital, and need to get treated for, let's say, heartburn. Let's say staggerome. Let's say numerous of things. And our white counterpart can easily go in for the same thing. So if I'm going in for heartburn, and John's going in for heartburn, Billy's going in for heartburn, guess who's going to get picked first? It came in at the same time. We going in for the same thing. But guess who's going to get picked first? They're going to get picked first. Because of their privilege. Because they don't care about us. Many of us died in the waiting room before we even got seen. Or said, oh, we can't see you because we don't take your HMO, we don't take your insurance, we don't take anything that you have to offer. How? How is that fair? How is that right? How is that allowed? Because we all need to be treated. We all need to be taken care of. We all need to make sure that we are good. But the health system is fucked. It's completely fucked up. And for this to still be allowed, for this to still be a thing, for this to still be a conversation, continues to show me that we're not getting better. We're not going in the right direction. Because people are still dying in waiting rooms. With COVID, more black and more colored people died from this because they wasn't treated, or they began to treat them when it was too late, or they decided to treat them when they decided to treat them. But 9 times out of 10, we wasn't treated. We was looked at and said, "Go ahead, go home." For us to die in our homes. For us to be so sick and don't know why, because you're not diagnosing this correctly. Because you're taking your sweet time to come back to the waiting room to tell us what's going on. With these vaccines, I don't know what to think about them. Because I know, for me, and I know a lot of my colored brothers and sisters, we definitely don't necessarily trust the healthcare industry. We don't necessarily trust government and what they put out into the world and what they put out into the atmosphere. I don't know if what they're putting in this vaccine, because they're starting with the elderly, like especially in the colored areas. And they're starting with the older people because they don't know what's going on, or their kids is making them get it. So they don't even have a right. And for something to be quote unquote around for a year, and now all of a sudden there's a vaccine, but now we have to think that it's not man-made, it wasn't made, it wasn't just drifted into the air. Like, we're smarter than that. We know what this is. We know what it is. There's been many viruses and basically pandemics before, with the swine flu, with the Spanish flu, with this, with that. Like, COVID is definitely different in terms of pandemics and in terms of like the amount of people that they killed drastically. All because y'all wanted to kill us off. And the ones who's dying the most is the black and brown kids. The black and brown people. Why? Why is the healthcare system not the same all across the board? Why is our HMOs or our insurance or our co-pays more money? Why do we have to try to go out of our network to try to get better treatment than our neighborhoods, where we'll be in there for 5 hours just to be seen, and then another 2 hours just to see a doctor? That's an issue. Like, I'm in pain, I'm on my deathbed, I'm on this, I'm on that, and I'm waiting all this time just to be seen. But this person just came in and they're in and out. Or, oh my gosh, this is more important than you. Their life is more important than your life. When does that stop? When does integrity come in with these doctors? Like, they take an oath to be there for their patients, but they kill their patients. They know something's going on, like the Tuskegee experiment. These doctors know what's going on. These doctors are aware of the experiment. They're aware of how long it lasted. And then did nothing to help any black and brown kids. Nothing at all. we had the swine flu and the Spanish flu. Spanish flu lasted 2 years. I don't remember what quote unquote the cure was or quote unquote how it stopped. But from that to here, medicine have increased drastically. And I'm just confused or baffled on how no one was prepared for something like this to happen again. I don't understand how the government puts out a vaccine that doesn't even cure. We don't even know what's in it. They don't even know what's in it. It takes longer than a year for a vaccine to be created, to be thought of, to go to a CDC, to go through all of that. It takes about 3 to 5 years for that to fully happen. And with most vaccines, as we know, like the flu shot and the XYZ, they give you a strand of the whatever that is. So in this case, they would give you a strand of COVID in order to protect you from the full-blown COVID. Just like the flu, they give you a little part of the flu, so I guess see how your body adapts to it and to fight it, so then when you get the flu, you won't ever get it, kind of thing. And they're not even giving you part of the COVID because they don't fully know what COVID is yet. So you get one dose of this imaginary stuff, and then you have to come back 21 days later to get a second dose of this imaginary stuff, and the second dose is supposed to be worse or stronger or something than the first dose. And how's that supposed to work? How's that curing you from anything? How are you making these people try to get this? I feel like the government's definitely going to try to force this on us. In order to travel, in order to do this, in order to do that, we're going to have to quote unquote be vaccinated so that we're quote unquote safe. But ultimately, if you have health and underlying conditions, unfortunately, you probably won't survive the vaccination if you do get it. You're probably better off being here fighting COVID than getting this vaccine. Because we still don't know what's in it. We don't know what the elements is. We don't know what it's protecting. We still have to wear the mask a year after. So, what is it covering me for? Is what I'm not understanding. I'm not getting. And then with government and how they treat us, if we're sick, we can easily just die in the waiting room. Or just not knowing what's in it. What created COVID for one. And what are they creating this vaccine out of? What are the elements of this vaccine? What are you putting in this vaccine that's going to protect me? So, of course, it's up to anyone and everyone who would decide to get it. But for me, no. I can't trust it. I can't trust the government in terms of any of that stuff. Yeah. So, thank you for listening. This is Give Me with the Cheese channel. Definitely listen. Hit me up on Facebook at Game Holder, on IG Game Holder. Let me know what you think. If you want to get on my podcast and promote something, have a great conversation about music, about real life shit that's happening right now, about anything. Let's chop it up. If you're a music artist and you want to promote your music, spit some bars, sing something, just definitely hit me up as well. And give me feedback on this episode and let's talk. Thank y'all.